Our cultural presentation was on organ trafficking, and the group members are Shelby Moriam, Caitlin Hansen, Brittany Dreesen, and Caitlin Doherty.
Since the second half of the 20th century, the success of healthy organ transplantation has enabled doctors to save and improve the lives of many people whose own organs have failed. There are almost 114,000 people in the United States that are currently on the waiting list for life-saving organ transplant, while another person is added to the list every 10 minutes. These transplants have generated debates about the ethical standards and policies that govern transplant. In addition, the demand for organs have outstripped the supply, creating an underground market for illegally obtained organs. And that's where organ trafficking comes into play. Organ trafficking can be defined as the practice of using exploitation, coercion, or fraud to steal or illegally purchase or sell organs. This photograph represents organ transplantation rates in the year of 2017. Travel for transplantation may involve organ trafficking when the resources are accessible, such as the organs, professionals, and transplant centers. This photo represents the targets of organ trafficking. The kidneys are the most commonly harvested organ from living donors. It is difficult to know exactly how much organ tourism generates annually worldwide, but it is estimated that the illegal organ trade generates approximately $840 million to $1.7 billion annually. It has been said that if one's body is their own, they should have the right to independence, for example, to sell their own body parts. However, there are limitations on independence in order to protect individuals from themselves. The argument of the proponents of organ trafficking include to provide organs to those who need them, possibilities of optimum utilization, vital source of supply of organs and tissues, and to avoid unwanted trade and crime. On the other hand, the opponents of organ trafficking include dilution of altruism in society, risk for quality of donated organs would decrease, doubts about voluntariness of those who accept financial incentives for donation, and the treatment of human beings and their body parts as commodities.
Next, we will be discussing the ethics of organ trafficking. According to the Declaration of Istanbul in 2008, organ trafficking and transplant tourism violate the principles of equity, justice, and respect for human dignity. Bagari, in a 2015 article, found that the technical requirements of transplantation are so formidable that to conduct such activities in a clandestine manner is a practical impossibility unless healthcare professionals are involved. The Council of Europe in 2002 stated that the human body and its parts shall not, as such, give rise to financial gain. And the World Health Organization, or WHO's, guiding principles in 2010 stated, no cells, tissues, or organs should be removed from the body of a living minor for the purpose of transplantation other than narrow exceptions allowed under national law. When appropriate, assent should also be obtained before donation. So the ethical principles that are being violated by organ trafficking are numerous, but the top three include autonomy. When someone is having their organs trafficked, they are having their decisions of their body taken away from them. In the US and other countries, consent forms are required for transplantation, and a child can only donate organs in certain cases, such as regenerative tissues. If a child has agreed to transplantation and ultimately decides not to, their autonomy and decision is taken over that of the consent form, just as it would be for an adult. Non-malfeasance is also violated via the forced removal of organs. These people who are having their organs removed are experiencing undue and unnecessary pain. Beneficence is also violated as the persons are being treated in a manner that shows that the doctor's desire to do good is not being considered. In two examples of ethical dilemmas from Bagari's 2015 article, we find that Syrian terrorists were recruiting doctors to come in and harvest the organs of their dead fighters as well as their hostages. Some of these hostages were actually children as well. In this example, the doctors are violating autonomy, beneficence, non-malfeasance, and justice. And in some countries, parents are actually previous victims of organ trafficking, and they end up becoming the brokers of their own children's organs. In this situation, the child's autonomy is violated. Also violated or disregarded in this situation are the ideas of beneficence and when the medical professional possibly becomes involved, not malfeasance. So an excerpt from the article from 2015, Bagari stated that in order for organ transplantation to have a chance of success, a number of sophisticated medical procedures must be conducted. Some examples of these procedures include blood and tissue typing and determining the suitability of an organ.
So what are the potential outcomes of the innovation for parents, the healthcare system, costs of healthcare, and healthcare providers? The organ trafficking trade affects all these things on multiple levels. One business called the Global Kidney Exchange is a business that some think is unethical and some think it's ethical. So it can expand the genetic diversity of the kidney transplant pool because we are having kidneys available across the entire globe. However, people think it's unethical because in order to get a kidney from the Global Kidney Exchange for someone that lives in a low to middle income country, there needs to be a living donor who donates a kidney to a high income country participant. So some would say that's tit for tat. The Global Kidney Exchange will pay for the low income person to get the kidney, pay for the surgery, pay for the costs of recovery and follow up, but they expect to get a kidney to be given to someone in a high income country. This also could possibly violate the principle of non-payment for organs, and it could be considered organ trafficking. It also is causing less family members to donate organs to people in low income countries, because even if a family member can donate to someone a kidney, they can't afford the surgery or the follow-up costs. So less family members are donating and turning to the Global Kidney Exchange. However, a pro for it would be that it reduces disparities in donation and transplantation, which could prevent organ trafficking. Interestingly enough, University of Minnesota legal team checked into the ethical debate on this Global Kidney Exchange, and they decided it was all right to use, but several are still arguing it promotes organ trafficking. Continuing on with that, there is something called medical tourism, and that actually is okay because that's where the United States insurance companies are including foreign care in their coverage. They're allowing people from the United States to go get surgeries and medical procedures in other countries, probably because it is cheaper to do so. However, part of that isn't legal is the transplant tourism. This is where people are leaving higher income countries and they're going to get transplants such as kidneys or other organs in the other parts of the world. That makes up 10% of the world's transplant tourism. So some people say, is it ethical or unethical? Most people think it's unethical because they're going to poor countries where vulnerable populations are living and harvesting organs for themselves. Many times these surgeries go wrong and they can possibly contract HIV, hepatitis B, hepatitis C, fungus, bacteria, other parasites. Then the patients come back to the United States or these other higher income countries with these medical problems and that they have gotten when they got this transplant in another country. And some are saying that maybe we should just have a regulated organ market or a compensation program. They're saying just instead of having this organ trafficking on the black market, just make it a market that's legal. And they think it could reduce the healthcare costs. And one interesting thing that was found was that dialysis is far more expensive than a kidney transplant. So insurance companies would much rather pay for a kidney transplant, follow-up care, and some anti-rejection meds than continue to pay for dialysis treatment. What are potential outcomes or innovation for patients? Just continuing on with that. So there is a role of the healthcare provider in organ trafficking in 3 phases. The information phase is where they're just talking to a patient and the patient says they might be tempted to buy an organ. Physicians need to stress the unethical and social problems with that. There's risk for the donor in the other country to get sick or have complications, and there's also risk for the recipient contracting diseases or having other problems as mentioned on the previous slide. So they just need to stress that. Then in the pre-transplant phase, where the patient has decided they are going to go and get an organ illegally in another country, the doctor, it's a free world, they can't prevent them, they can continue to stress the unethical parts to this decision. However, the physician has to release their medical record, but the physician does not need to write any letters to surgeons in other countries, perform any tests, or help any other way whatsoever to help this person in the illegal pursuit of an organ transplant. They only have to release the medical record. Then in the post-transplant phase, after the patient has been to another country and has received an organ illegally through organ trafficking, they come back to the United States and will need follow-up care and possibly have complications. The provider still does have to provide medical services to those patients because those patients are still their patients and they're in the United States. So even if they know they got an organ illegally, they still have to take care of them. And some are saying legal reform is needed in order for physicians to report which patients have organs through organ trafficking. However, with HIPAA and confidentiality laws, that prevents physicians saying who has had illegal organs purchased through organ trafficking. So more studies need to be conducted on this phase of the organ transplant.
Next, we're going to discuss the 3 implications related to organ trafficking. The first one involves the cultural aspect, the second one is the spiritual aspect, and the third one is the theological aspect. There are many cultural taboos surrounding organ donation. Cultural and religious views have important roles in the formation of beliefs about organ donation. The first group we're going to talk about is the cultural group. Cultural customs ban or discourage some individuals from donating organs willingly or receiving post-mortem organ donations. Culture can be a very strong influence on raising public willingness to become an organ donor. 3 examples we're going to talk about. First off, China has enacted its first organ donation law in the year of 2007. The groups of African Americans and Hispanics often cite a sense of distrust of established authority as a reason for not wanting to register to become an organ donor. And last but not least, we as Americans in general do not like to think or talk about death. Some beliefs may prevent families from consenting to organ donation. This goes under the category of the spiritual aspect. The Asian cultures do not usually condone organ transplantation because they will be looked down upon within their community. The Asian population believes that the dead individual will then be looking for his or her missing body parts for that eternity. People with spiritual beliefs may have an unwillingness to become an organ donor. Providing an opportunity to consult with a religious leader about organ donation can aid families in passing through hard circumstances in order to make the best decision possible for their loved one within their life. Last but not least, we're going to discuss the theological aspect. Islam countries usually do not allow anything to violate the human body, but if a transplant can save a life, that is considered an exception within the Islamic religion. Christianity accepts organ transplantation. The group of Jehovah's Witnesses believe that it is up to the patient if they want an organ transplant, but they are not allowed to have blood transplanted. Judaism considers organ donation specific to brainstem death, or the heart stopping from beating and bleeding. Hinduism accepts organ donation and the use of organs or body parts. They believe it is an important part of the Hindu faith. Of most importance, we're going to talk about how nursing practice will be impacted by organ trafficking development by the year of 2020 if it is continued to allow to be proceeded. All in all, organ trafficking results in a global shortage of organs that has driven this industry. This industry relies on both poor populations to be donors as well as wealthy foreigners to be recipients. Global health concerns and issues, such as organ trafficking, require an action for all nurses, a call to action for all nurses. Nurses must respond, plan, prevent, prepare, and perform care that reflects health equity among these issues. Caring for a victim of human trafficking can be very traumatic and frustrating, but the nurse must ensure that all staff members are educated on how to identify and report any signs of human trafficking. Most importantly, as nurses, we must connect patients with services and support systems to help those who have been suffering a case of human trafficking. With proper training and support, healthcare professionals can rise from this challenging and difficult process. Thanks for listening to our presentation. We as a group encourage you to take the steps in becoming an organ donor today.